Good afternoon, everyone. Just a quick sound check. Can we hear me all the way in the back? Good. All right. Thank you, everyone, for attending today's informational meeting on the individual health insurance options for 2020. Just a quick note as to who we are. My name is Johnny DeVito with IXSolutions. Here with me today and presenting is Grace Hare. Grace is one of our individual specialists and is very knowledgeable about the options for the individual market with regard to health insurance and what the options are going to be in the upcoming year. Grace is going to be educating everyone today on networks, plan designs, such as deductibles, out-of-pockets, and whatnot, and then timeframes, most importantly, at this very moment, because we are in the midst of open enrollment. So this is the time of year. But Grace is here to explain all that and answer any questions along with myself. So we are a good-sized group today, which is always good to see. But at the same time, I think we're still small enough to be able to take questions throughout the presentation. So with that being said, if you would just kindly raise your hand. If Grace makes eye contact with you, she'll address your question as soon as she possibly can. But feel free to ask questions, and we'll be here as well afterwards to talk with anyone one-on-one and answer any questions that you may not be comfortable asking in front of the group. Also keep in mind that if there are questions you do have, it's very possible that others in the room do have those questions, so please don't be afraid. But if there are personal questions, we'll be here afterwards to address those for you. So with that being said, please enjoy the food and the drinks, and I'll introduce Grace Hare.
Thanks, Johnny. Hi, everyone. Good afternoon. Okay, sound check for me now. Can everybody hear me back there? Great. Okay, who's ready to talk about health insurance? Welcome. Oh, sorry, give me 1 second, actually. Let's set something up. I want to have my notes on the panel. But that's okay, I can do it with them.
Yeah.
Health insurance is scary. With all the options out there and not knowing which plans to go with, it can be intimidating. It can also be very confusing because it changes every year. We are here, myself especially, to provide support and guidance for you as members of the CBA, help you navigate this confusing system, keep you up to date with regulations, as well as help you find the best plan that's out there for your healthcare needs. Here's just a list of the products that we offer and services that you can buy. You can shop on the website if you've never been. You can explore all these options on your own online. You can also, and I highly encourage to do so, you call us and we'll walk you through it. So right now, and really the reason for the timing of this seminar, we are currently in open enrollment period, as many of you may know. The last day to apply is December 15th. It did kick off on November 1st, so we're nearing the middle. All plans enrolled in during this time are eligible for a January 1st effective date. I also want to note, this is the only time of year that you can make a change, enroll in a new plan for the first time, outside of having a qualifying life event. Qualifying life events, most common ones include a permanent move, a change in family demographics such as getting married, having a divorce, having a baby. If your COBRA is terminating or you're losing group coverage through an employer, any type of involuntary loss of coverage. And carriers will require proof of that loss, and such as a certificate of credible coverage, if a baby is being born, a birth certificate, things like that. And what these qualifying life events do is they open up a 60-day window for you, like your own open enrollment period, outside of the regulated open enrollment period that we're in right now. So I just want to touch on healthcare reform and the Affordable Care Act and what that really means. It's been in place now for 5 years. And every individual health insurance plan sold is required to cover these 10 essential health benefits listed. So, for example, if right now is a popular time of year to get a flu vaccination, if you have an ACA plan, that should have costed you $0. So all of these things are included at no charge. Another thing is that all plans are guaranteed issue, meaning that you can't be denied coverage. Although new as of January 1st, 2019, you're not legally required to have this ACA coverage anymore. That individual mandate was eliminated, and that means that there's no more penalty for not having insurance, although obviously it's still a good thing. On exchange versus off exchange. Many of you have probably heard these terms before. What do they really mean? On exchange is going to be all plans on the marketplace, so on healthcare.gov. Subsidy eligible plans. So if you can buy it on healthcare.gov, that's considered on the exchange. Off exchange, there's actually going to be more plan options. Carriers will select plans that are subsidy eligible and put them on the marketplace. So there's actually more plan options when you shop off the exchange. But one good thing to note is all plans, no matter on or off, are all ACA plans. So every fully insured health plan sold today is under the Affordable Care Act. It'll be guaranteed issue, it'll cover your pre-existing conditions, and it'll include those 10 essential health benefits. Short-term medical. So these are great. So let's say you don't have coverage right now, and you're like, well, wait, if I enroll right now, I'm not going to have coverage start till January 1st. Short-term medical is really meant for gaps in coverage. In the past, it was available for almost year-round, and people would enroll in it kind of as instead of an ACA plan. They've gotten a little more strict on the rules with that, so now they're only available for up to 180 days max in length. And if you wanted to re-enroll once that 6 months is up, you can, but they place a 60-day gap on going with the same carrier, so you would just need to do a carrier switch. And there are some carrier options that are guaranteed issue for these short-term medical plans. But even if you enroll in one and you have a pre-existing condition, one thing to keep in mind is these do not cover pre-existing conditions. But they are less than half the price of the ACA plans, and they utilize large PPO network through UnitedHealthcare. So now I'm going to dive deeper into what's new for 2020. So every year, health insurance carriers basically have to decide two things. Are they going to participate at all? And are they going to sell the same plans that they did in previous years? In 2016, we lost UnitedHealthcare, Aetna, Land of Lincoln, as well as Harkin Health, who used to participate in the individual market. They no longer offer individual fully insured health insurance plans. I mentioned UnitedHealthcare does offer a short-term plan, but they do not offer like a fully insured ACA option. So really the players in the game in the state of Illinois, the main players, Blue Cross Blue Shield, they're going to be the only carrier that offers a PPO. And now I'm diving into this, I'll move forward. There are two other carrier options, Cigna and Ambetter. Ambetter's kind of new in the markets for the last few years. Cigna and Ambetter both only offer one narrow network HMO plan that's very comparable to the Blue Focus Care that you see up there on the bottom. And I'm going to dive deeper into each of the network options available. But for those reasons, and since Blue Cross has been in the individual market since 2014, they are the best carrier out there in the individual market. Okay, so the Blue Choice Preferred PPO. Again, this is the only PPO plan as an individual that you can enroll in the state of Illinois. Only fully insured PPO option. It does not include major teaching hospitals such as Northwestern, North Shore, Rush, University of Chicago. But it is the only plan that's going to give you access to a Blue card. So if you are somebody who travels out of state regularly, highly recommend this because the Blue card has a phone number on it, and if you're in Alabama, Florida, California, you call that number and they'll direct you to in-network doctors and hospitals. And this is the only plan that will really give you the option to do that. Blue Precision HMO. This is going to be the largest HMO network in the state. It has been the most popular plan option I've seen individuals enrolling in the last 3 years because it includes North Shore University Health System, it includes all of the Advocate health systems, as well as it is the only plan that allows any access to Northwestern. Now it's not full access, I shouldn't say, but it is It does allow access to Northwestern, and now that it's been out there for 3 years, I've seen success in individuals utilizing that. You just designate the medical group for Northwestern, and you can see your specialist without a referral. Blue Care Direct HMO. This is a great one if you solely work within Advocate Healthcare System. I call it an open access HMO because you don't need a referral. You just work within the Advocate Healthcare System. And like typically with HMOs, you have to coordinate everything through a primary care physician. With the Blue Care Direct, as long as you remain with an advocate facility, that's not the case. And finally, the Blue Focus Care HMO. So this one is very similar. This is the same network that Cigna and Ambetter offer, that Cigna Connect and Ambetter Select. It's going to cover the same doctors and hospitals. I typically don't recommend this one unless you are someone who solely coordinates your care through like Mercy or Stroger or Holy Cross, because it is limited to 9 Cook County hospitals only. It's a very small network. But I have seen people enroll in it. If that is your hospital, it is the most cost-effective network for the very reason that it's the smallest network. Okay, how does health insurance work? So, start date for everyone enrolling now would be January 1st, and once that kicks off, you have a deductible to satisfy, really before the carrier starts paying anything at all. A lot of the plan options have copays, a very popular copay amount for specialists, urgent care visits, primary care is going to be $20. The lowest deductible option out there is $750, so I gave this plan structure example. This would be like a gold plan structure, so like the richest plan structure available. So once you meet that $750 deductible, a coinsurance kicks in. And for this example, a 60-40 split, what that means is you pay 40% of the bill, carrier pays 60%, and you'll pay that split after the deductible is met until you meet the out-of-pocket maximum. Once you meet that out-of-pocket maximum, carrier is going to pay 100% of your bill, as long as you're going in network. The only exception to going out of network for carrier paying anything is going to be an emergency. In the event you have an emergency, it'll be subject to the out-of-pocket maximum of your plan. But if you go out of network voluntarily for something, it will be an unlimited amount of money, up to no maximum. So highly encourage calling us, calling myself, and I'll help you search your physicians, make sure that they're in network so you don't have those expenses. Just some tips on selecting a plan. A few questions to kind of ask yourself. I like to start with, what are your biggest priorities? If it really is cost and you don't even maybe hope to use this plan, maybe you go with a high deductible option in a smaller network. That will really help you narrow down the options available. And then, are you a high utilizer? Again, if you've never met your deductible in past years, maybe you continue to go with that high deductible option. Pair it with an HSA. If you do have a high deductible health plan, I highly encourage opening a health savings account. That's going to be a triple tax advantage account. Money goes in tax-free, grows tax-free, and it's your health savings account. So you own it. You can use it at any point in time, and you can use it for any medical expenses outside of your premium. So some additional CBA member benefits I want to touch on. Did I have any questions that I missed? Yes?
Can you use the money in the HSA to pay for your Blue Cross Blue Shield plan?
Anything outside of the premium. So you wouldn't be able to use the HSA. The question was, can you use an HSA for the Blue Cross plan? Not for that monthly premium to have the plan, but for, let's say you're going to a doctor's appointment and the bill is $150. That would be tax-free if you used your HSA. So you can do that. Yes? Yes, there is, and that changes every year. Do you know the max this year?
$3,500 is an individual, $7,000 family.
$3,500 and it is an individual, and I believe Jen, $7,000 as a family. So that's the 2020 limits. The money stays there, so that's the great part. It keeps rolling over. Yes, you can keep adding every year. Yeah, so some people really just add every year and never touch that money until retirement. So that's a great thing about it. You own it. Yes? I'm sorry, can you repeat the question? Yes, there are. You would just have to make sure that the plan that you're selecting is an HSA compatible plan, which is going to be options in the PPO network only. So that really narrows down, if you're passionate about opening an HSA, which I love them, then that makes plan decision very easy. Good? Okay. Additional CBA member benefits. So we recently have the ability to offer auto and home insurance. That's typically only offered on a group level to large businesses. So we're pretty excited about this one. We're seeing people save up to almost $600 on their auto insurance. So really, to access the discount, you'll just want to call the phone number here. I also had flyers handed out in front, and use the discount code EMP. Yes.
For any of these benefits that you're talking about now for CBA, I'm a CBA member, but my whole family isn't. So would that apply for my whole family?
Yes, it would. Definitely.
Repeat the question.
I'm sorry. Her question was, she's a CBA member, but her family members aren't. Could they apply as a family under her? And the answer is yes. Yes.
That healthcare you said was the smaller network. I think it was Blue Focus.
Yes,
Yeah. Is Providence Hospital one of them?
it is. It is. You're welcome. Yes, in the back.
Financial benefits to going through a CBA, being a CBA member versus just signing up for health insurance on the public exchange. Doesn't seem like there's any advantage.
Yeah. There are no financial benefits because health insurance is regulated, so premiums are really going to be based on where you live and how old you are and whether you smoke tobacco or not. That's how they're rated. But really the benefit of going through an agency like ourselves is the assistance. So getting to work with someone like me versus waiting on hold on healthcare.gov for a couple hours this time of year, and really, the hand-holding and making sure that you're taken care of. Yes?
So you can have children to these policies?
Yes.
Is there any age limit? So I have a 26-year-old.
Oh, that's a great question.
So can you add those on? Because then actually their medical expenses can go toward the family deductible.
Correct. Oh, yes, I'm sorry. Yes, I apologize. So this question in front is, can you add your dependents? So, for example, she has a 26-year-old and a 22-year-old. The 22-year-old, yes. 26 is actually the age that dependents are kicked off your health insurance. But yes, the answer is yes. Yes, in the back.
Has there been any discussion about associations for members like a CBA member or that? Is there any movement with regard to allowing them to combine into an association?
That's a great question. I can take that.
Sure.
You want to take it?
Sure. Yeah, so I believe the question was, is there any movement towards bringing together a pool of people to provide better access to coverage from a network standpoint and ideally a price standpoint? And the way that that'll answer that at this very moment is that we're looking to bring something like that together. Nothing official has happened, so I can't bring any false hope to this situation. But this is something that we're working towards. Really what it has come down to is bringing carriers into the situation that are going to be willing to entertain this type of scenario. So stay tuned, but at the moment there is not an option with regard to that type of pooling plan.
How would you find out if there would be an option?
So you would hear that first and foremost from the CBA. We would do essentially a blast. It'd be a very exciting piece of news because I know this is something that most CBA members are looking for. And it would be hopefully an ideal situation. So I can promise you that should we kick this off here in the near future or even down the road, IXSolutions along with the CBA will be the first to tell every one of you as members.
Any other questions? No? Yes.
Is that just a industry push against it, or there's no legal impediments to having a group form by that pool?
Sure. There are parameters that have been put in place around this. So just to give you a little bit of insight, there was a lot of hype around this, I'd say about a year ago. Carriers explored it. Some carriers even put these type of association pooling health plans in place and have since had to pull them back. Some of them in particular around the country, effective February 1st, will be eliminating those types of plans, and now the association members have to go find alternative coverage. At the moment, it is legally possible, but there are strict parameters around it that the carriers have made very clear that they will or will not entertain these type of situations. Yes.
Actually, you said there were other questions. I actually have not that.
Sure.
Yeah. So on the Blue Cross PPO one, the individual one, if you go out of network, I think they pay 50%. Is that correct?
No. If you go out of network, it's going to be an unlimited expense out of pocket on your end. Carrier would not contribute anything, in the exception of an emergency. If you, I guess I shouldn't say that, because with the PPO, with the Blue Card, and you're technically out of network, it falls within the Blue Card network, then they would contribute. So just make sure if you are like out of state or out of network to call that number, and Blue Cross will direct you in network doctors and hospitals.
When I was reading on their website for the PPO, which is the one you're saying, it says they do pay for out of network. There's a contribution. There's just no out of pocket max, but it says that they do actually contribute toward out of network. Am I?
Oh, yeah.
So the question was, when we go out of network with these individual Blue Cross plans, is there any coinsurance? Typically, what you would find underneath a group plan or a company's plan is a 50% coinsurance after you've met the deductible, should you be out of network, until you've met your out-of-pocket maximum. Unfortunately, with the difference in the two markets, and what I'm referring to is the group market, where companies offer insurance, versus the individual market, there are some significant differences in the plan designs and the way that they work. And in this situation, when it comes to individuals, the out-of-network coinsurance is essentially not going to exist. You'd be responsible for the full cost. So that's why it's so important to stay within that network. And a big reason as to why Grace was recommending the PPO, because should you be traveling, you'll be able to utilize that Blue Card, where you can be referred to essentially a partnering network in that particular state that Blue Cross works with. So in that scenario, you call that number on the Blue Card, tell them where you're at or the zip code you're located in, and they'll put you in touch with a handful of in-network providers within that particular area and state.
What happens
Yes.
if you're traveling with any of the other options, if you're out of the state?
There's,
And if you're in a car accident or something?
Yeah.
You have no coverage whatsoever?
that's correct. So I'm going to repeat the question. If you are traveling out of state and you need, you want to go to the doctor, there is no coverage whatsoever if you select anything but the PPO network. In the exception of an emergency, so I think you mentioned a car crash, that would be an emergency, and of course if you need to be transported via ambulance, or even if you were having a heart attack and you could walk yourself into an ER, that would be treated as in-network. It would be subject to the $1,000 ER copay plus the coinsurance of your plan up to the out-of-pocket maximum. So that's a good question. Mm-hmm. Yes.
More of a comment. Alliance travel insurance, if you're going on a trip and you're going out of state, it's actually really cheap and they get great reviews, and they do have medical coverage. So if something like that happens, you can use that travel insurance if you have a small network here or you have an HMO.
Yes, and thank you for mentioning that. We do offer travel insurance. I'm sorry.
So if we're out of the country too.
Yes, for out of the country as well. So, yep, and it is very, very affordable. Yes, I'm sorry.
So under the Blue Cross, the Blue Choice Preferred, it says that they pay 50% of the eligible charge inpatient for a non-participating provider.
Can we? I'll look at what you're looking at later. We'll talk about it after.
No, of course.
It's not exchange, it's non-exchange. But they said they pay 50%. The problem is there's no out-of-pocket mix, but theoretically you could go to Northwestern then and just pay 50% of the charge.
Sure.
Okay.
Yeah, we'll definitely take a look if you want to come after. Thank you. Yes, I'm sorry.
I just want to know, what would be necessary to convert your individual or private plan into a group plan? Is it just having one employee on board to give you that access to much better coverage?
Yeah, that's a great question. Oh, go ahead.
That one employee, can that be a relative that you can hire part-time, or what's the minimum requirement
Of course. So the question was, what are the requirements for having a group plan, essentially? How many employees are needed? Can it be a relative? The answer is no, it cannot be a spouse if you only have one employee. So carriers will not write husband-spouse or husband-wife groups. And you do need one full-time eligible employee to form a group plan. And full-time be 30 plus hours a week.
Outside of the spouse, could it be some another relative, that's not a spouse?
Yes.
It can be, yes. So son or daughter.
Repeat the question.
Oh, yes. So the question is, if it's not a spouse, can it be a relative? The answer is yes. So brother, son or daughter, yes, you can form a group plan if they work for you full-time.
The original person doesn't have to take the coverage. Like, so let's say the owner is eligible for Medicare. They can employ their child and then get insurance under the group plan?
That's correct.
Yeah.
Yeah, the employer does not have to take the coverage.
Or the employer could be on their wife's coverage and then they could employ
Correct.
someone, and then do you get a better network?
Yes, you're always going to. So the question is, do you get a better network with group? It is better network options. For example, the national PPO network, that essentially be hard to find a doctor that wasn't in network. Kind of the opposite scenario of individual. But there are those requirements for forming a group, and that is actually something that Johnny here specializes in. So if you have questions about your business, if you have a business, definitely stay and ask him after. Yes, in the back.
What's the pushback against an association members versus a small group plan people put on? It seems to me, why pushback? Why do you not want to allow this to happen?
Sure. That's a great question. The question is why the pushback on these type of situations. And quite honestly, I mean, we could talk later about my personal opinion, but in the end, this comes down to the carrier's decision. They have decided to either not pursue these type of scenarios or tread very lightly. From what we've seen roll out, they have not been a huge success so far in other states with other carriers. In the end, what's being learned is that these type of scenarios come together, and the premium is not exactly as competitive as everyone would hope. So, to answer your question, I can't speak on behalf of the carrier. I don't know why they don't want to pursue these types of things, but that just seems to be kind of how they've approached it. They're not all that interested in it. I think there may be some risk on their end that we all may not be aware of, but in the end, it's just not an option at this very moment. But we would be looking to bring that to you as soon as we possibly can. I'd also like to address one more thing, just to go back to this group scenario, because I'm sure everyone in the room may be wondering, how do I access the better networks and ideally better coverage? So just to kind of hit on some key points, to form a group, you would need at least 2 eligible employees, full-time eligible, with as few as 1 participating. That is their requirement. In the end, as Grace mentioned, they don't allow for husband and wife groups. They will allow for other relatives to be that second eligible employee, even if one of the 2 eligible individuals within the company is not participating. In other words, a one-person group. That is allowed. However, the requirements around this just keep getting more and more strict, and at this point in time, if you were looking to do this tomorrow, let's say, the carriers that are offering these small group plans are going to require that you have this particular additional employee on payroll for at least 12 months. So what they're trying to avoid there is you going to hire someone in order to obtain access to networks and these plans. So you would have had to have hired this individual roughly a year ago in order to put this type of plan in place today underneath the company. Any questions on that?
I believe in the back you had a question.
Yes.
Yeah, my question, I think, was back to Grace maybe. I want to make sure I'm kind of looking through the thing. My preferred provider is Northwestern Doctor. And most of the ACA plans for the individuals don't have access to my doctor.
Okay.
He's not on there. So, and it sounds like the PPO, the Blue Cross referring PPO or whatever, doesn't have access to Northwestern doctors. If I want access to Northwestern doctors, I have to go to the HMO. But the HMO, I would not be eligible to open an HSA account. Is that correct?
That's correct. So Yes. His question was he wants to access Northwestern, but he'd like to have the PPO to access the HSA account. If you want to access Northwestern, you really need to go with the Blue Precision HMO. The PPO just does not cover any of the major teaching hospitals or North Shore or even Advocate, surprisingly. It'll cover a lot of hospitals, and it's the largest network and allows you to go out of state, but yes.
So, just to follow up, so what I've been doing, been going with short-term care, have access to the doctor I want to have access to. It's just crazy work around.
It is.
I don't know this question. Just want to make sure I
Yeah, no. You understand.
exactly what I need to do.
You're doing exactly for what you're trying to do. You're doing exactly what you need to do. Yes. Yes. Sorry, in the back.
So do you handle short-term care? And that's the first part. The second part is I've heard some people say that it's a workaround is to get short-term care with discounting exchange, and then there's a supplemental insurance policy that's a lump sum payment for a one-time injury.
Yes.
Supplement. Do you guys handle that?
Yes, we do. And actually, on our website, we've labeled it as packaged health insurance because it is something that many people explore. So essentially, the question is do we offer short-term and these supplemental products? And yes, and people will combine them. So you can get a short-term plan and then also purchase a critical illness plan, which then, and an accident policy in addition to that. So if you get in an accident, it pays you a lump sum. If you get diagnosed with cancer, any major critical illness, it'll pay you a lump cash benefit. And that's your money to spend as you want, but obviously it's meant to be spent towards those medical expenses incurred with an accident or illness. Question here first, I'm sorry.
You said after 6 months you have to change carrier. So you change carrier, then after the next 6 months, can you go back to that other carrier? Or
Yes, you can. The question was, can you go back to a carrier after you've switched to another one? So the rule with short term and another workaround with it is they're only available in the state of Illinois for 6 months at a time. So once you're done with that 6 months, you would need to switch carriers to dovetail right into the next plan, or you can wait 60 days to go back with the same carrier. But then once you go with another plan for that time period or wait the 60 days, you can go back to the original carrier of your choosing. Yes, what was your question?
If you get something in between, you can't get coverage necessarily. So if you got cancer on the first plan, and you wouldn't get coverage on your second one. So that's actually really, really risky. And then my other question is there any of these plans that got you like MD Anderson or the Mayo Clinic? You know, if you got something terrible and you didn't even want to go to Northwestern or you couldn't go to Northwestern, are there any of them that would let you go to any of those places?
The question was, can you go to like MD Anderson or the Mayo Clinic? Those would be considered out of network. You would not have access to those under any of the individual plans. Another point made just now was, you know, if you get diagnosed with a pre-existing condition or an illness while you're in the first 6 months and then you go to get another policy, well, they don't take pre-existing conditions as short-term plans. There are carriers and plans that are guaranteed issue, so you could still get another plan. So that is an option.
Like an exchange plan?
No, short-term plans that are guaranteed issue, like with National General or if you've heard of Pivot. So there are multiple options.
Address the fact that you can't go back into a fully insured plan too at that point outside of open enrollment.
Yes. Yeah. So a short-term plan expiring at the end of that 6 month period isn't a qualifying event. Johnny made a good point. So if you choose to do that, you would have to wait till the next open enrollment period. If you're like, well, now I really want a fully insured option, you would have to wait until the next open enrollment. And I did see a question on the left here.
It lapses after 6 months, you have to wait until November, December to get the next.
To get a fully insured option. You can get another short-term plan. Yes, I'm just saying if you change your mind. That's why, like some people that want to enroll in short-term right now, that's okay, but I would recommend, because you can cancel a Blue Cross policy, I would recommend enrolling during the open enrollment period and really thinking about it and doing that outside of open enrollment, because you can cancel a Blue Cross and go with short-term if that's what you want to do, but I would take advantage of the open enrollment period while it's here. Yes? No, there is no limit. I do not believe. You can use it, though it is yours for your lifetime, and it's a lot of people use it just as a savings account for retirement, so that when you are on Medicare, and then you can use that for your medical expenses as well.
Way back, but you had mentioned in the beginning there's the exchange, which is all that. What's the OffExchange? How do you find all this stuff?
Yeah, that's a great question. What is OffExchange? How do you find it? OffExchange is going to be anything not on healthcare.gov. So the reason that there's less plan options on healthcare.gov than off healthcare.gov is because those plans are subsidy eligible, and anything that's not eligible for a subsidy is going to be considered OffExchange. And that would be like just going direct to a carrier website and exploring is considered OffExchange. And we handle those. So if you call me, I will show you all plan options, OffExchange and on. So everything that's out there. Yes, in the middle.
Are you going to make the slides available?
Yes, I am going to be emailing out this. Yes, of course. The question was, am I going to be making the slides available after? And yes, I'll be emailing these out to all of you, as well as this is being recorded, so you can watch that on YouTube after. We'll be sharing that link as well. I probably won't watch it. What was the other question on the right? I'm sorry. Well, you can go first.
On the PPO, did you say that advocate is not covered?
In the PPO, correct. Advocate is not considered a network. It's going to be... And, okay, I guess a good point to make on that. The question was PPO is advocate in network. The answer is no. One thing to note, and I still would like to do a provider search for you because sometimes your doctor participates even though their affiliated hospital does not. A lot of doctors work within private practices outside of the hospital that they're affiliated with. So sometimes you'll still be able to see your doctor's an in-network doctor even though their affiliated hospital's out of network.
Okay,
Yeah.
one other question. So if you get the individual plan and you start paying for it, and then you get a new job with a large company, what's the cancellation policy?
Yeah, it's a great question. What's the cancellation policy if you get an opportunity to coverage through business or job and you want to cancel your individual plan? I would recommend canceling it before the end of the month so that you're not paying for that next month. So really, the standardized billing or for ACH payments or direct billing will be like the 30th, 31st, end of each month for the following. So as long as you cancel it before the end of the month, it'll be. And that's really it. And you can call and cancel. You can do it through Blue Access for members, which is a great. I always recommend if you get a Blue Cross plan to make a Blue Access for members account. You can see all your claims there and make sure that you're up to date on billing, things like that.
Blue Cross, does it give you a different network if you live in Lake County? You might work in Cook County, but you live in Lake County, and my understanding is then you cannot buy the same individual policy if you live in Lake County as if you live in Cook County,
That's
no matter where you work.
Yes, that's a great question. So I'll repeat the question. So if you work in Cook County, but your residency is in Lake County, residency is what you would apply with. Now, have I seen people apply with their work zip code and that be okay? Yes. The difference being Lake County is not going to have like the Blue Focus plan, for example. So that's Cook County only network, and you wouldn't have access to that network if you live in Lake County, which really, in a sense, those hospitals are very far from you. So some people don't, they want to go within wherever they live. Any other questions? Yes, in the back.
Are HSAs only associated with the ACA plans, or maybe associated with the short-term?
They're only going to be associated with ACA plans, HSA accounts. They are not associated with short-term plans. Yes. Yes. So all plans under the Affordable Care Act will include mental health and behavioral coverage. Yes. Yes. That's a good question. Any other questions? Yes.
Hi.
Hi.
The ISBA is membership about the possibility, I think, in one of these pools. Is the CBA coordinating with the ISBA?
That's a good question. The question was, is the ISPA working with the CBA on the pooling?
So the way I would answer that question is, no, we're not. The CBA is not coordinating with the ISBA at the moment to bring or make that as an option. To address what you had mentioned, there doesn't seem to be anything officially being launched at this time. What I believe they're looking to do is get a feel for participation, and then ultimately what the risk would look like. So, as I mentioned, we have things in the works with other carriers as well through the CBA, and we'll be the first to bring that to all of you as soon as it's an option. And I did want to circle back to one point question that was brought up regarding on-exchange and off-exchange. In the end, there's a set amount of plans available on exchange as well as a set amount of plans that are available off exchange. There's no incentive for someone who does not qualify for a subsidy to go and purchase an on-exchange policy. In the end, you also have to deal with healthcare.gov, because if you purchase a policy on exchange like that, healthcare.gov is going to be your broker. So they're the entity or individuals that you'd need to reach out to get any type of direction, questions answered, or any potential help with regard to your health insurance. So if you do qualify for a subsidy, I say it may not be a bad idea to take those dollars because it'll help you pay for your premium. Now, if you do not qualify for a subsidy, that's when you should be shopping off exchange, because in fact you're going to find a couple of additional plans that are available to you that may be more cost effective in the long run, while at the same time you then have IXSolutions as your broker to navigate through this complicated world of healthcare. So not just at the time of enrollment, but throughout the year, should you have questions about networks, even in a situation where you're looking to be able to access a certain provider because you're looking to have a certain procedure, you can lean on us as a concierge service made available to you through the CBA to have as your advocate to guide you through all of this, not just at the time of enrollment, but also throughout the year and utilizing your coverage. Yes.
How do you find out if you qualify for a subsidy?
I take that one. Yeah. Should have seen that coming. I should have mentioned this earlier. So the question is, how do you know if you qualify for a subsidy? If you file your taxes by yourself, the limits for 2020 are between $17,000 annually as your estimated gross income, and $49,000 is the cap. If you're on that higher end and you make $48,000, it may be possible you're only getting $10 off your monthly premium, but hey, $10 is $10. If you're closer to that $17,000, and you're kind of riding that line between 16 and 17, it's possible you're Medicaid eligible, which is going to be a zero premium health insurance, but you would have to coordinate through the Medicaid network.
And what about for a family?
For a family, so that's going to go, depending on the size. If it's just two, then the limits would go up $10,000, so it would be between $27,000 and $59,000. As you're combined, if you file your taxes together. Yes?
I always find deductibles really confusing.
Yeah, of course.
It's allocated to the deductible and what's not. I'm on a Blue Cross Blue Shield HMO, and I'm never sure what's going to count towards the deductible. I got 2 kids, they go to the doctors all the time. It never seems to count. Can you explain how that works?
Yeah, that's a great question. So the question is, what counts towards a deductible? Everything is going to count towards your deductible outside of the monthly premium, as well as any copay. So it's possible that when you go take your kids to the doctor, you're paying a copay amount, and that's not going to go towards the deductible. That'll just be an additional every visit expense. Okay.
The copay, though, will apply to your out-of-pocket maximum.
Oh, that's a good point.
So it will not apply to the deductible. It will apply to the out-of-pocket maximum. Same with like an emergency room visit, because it's considered a copay when you walk in. In other words, you pay ideally a couple $100s to walk into the emergency room. That's considered a copay, so that'll go towards your out-of-pocket. It will not apply to towards your deductible. And then services received then in the emergency room then will apply towards the deductible, as well as the out-of-pocket.
Yes?
How does the family deductible fit with the individual deductible?
That's a good question. So everyone's going to work towards their own individual deductible up to the family deductible. So let's say, for example, this is just an example plan. it's a $3,000 deductible, and that's what you see when you're looking online. But the family deductible is most likely somewhere near $15,000. So you will meet that individual deductible, and that'll all pool and go towards the family deductible.
So once you, if you're over the individual deductible, it still counts towards the family?
Correct. Correct. Mm-hmm. Make sense?
So the question was, how do deductible credits get met, individual versus family? In the end, I think, as Grace mentioned, the best way to look at that family deductible is that if you have multiple members of your family that are insured under your policy, each family member is going to have their own individual deductible. Now, if each one of your family members has met the deductible, then ultimately at some point you will have also met the out-of-pocket. So you're protected on an individual level, receiving your own services, but for family members, they'll have their own individual deductible. Together, you cannot exceed the family deductible.
Okay, so are you guys essentially done with your presentation?
Mm-hmm. Yeah, there's more down here, right?
Yeah, this is it.
Yes, so you're good. No, you're good with questions.
Yep. That's my direct contact info. That's all.
So is it safe to say that there's not really an HSA qualified plan that's going to cover the teaching hospitals? Doesn't exist.
That's correct. Mm-hmm. Yeah, so the only I'm sorry, go ahead.
Wonderful proposition. All right, and then regarding subsidies, what if a spouse would file separately? Could he qualify for the subsidy, or would it be under the whole family has to be?
You know, it's based on your household income. I have seen couples file separately and only put down their income, and I think it's just a matter of them catching that or not catching that.
So you don't know what the real rule is? It's kind of
Well, it's based on your household income. The rule is that if
all
you...
members of the house.
Yes,
You file
correct.
separately, basically, the total income in the house.
Correct. If you have dependents and there was a child working part-time at a restaurant, that would count.
So then you would go, if you tried it, then you would go to the .gov, and then you'd still be in the first question, like I said. There's no plan, there's no plan in .gov that's going to cover the hospitals.
Correct. The networks are going to be the same whether you're on healthcare.gov or off the exchange. Yes?
Is the subsidy, like the income, is that based off of your last year's taxes, or is it currently what you're making more now, but taxes obviously showing you less last year or whatever?
Yeah, of course. So it's based off of your estimated annual gross for the coming year. Now, obviously, it's a good marker to go based off what you made last year, and you can put that down, and you can edit your income if you all of a sudden start making a lot more or your income drops drastically. You can edit that at any point in time through your account on healthcare.gov. And I highly encourage doing that because it's kind of a matter of owing a lot at the end or vice versa. Any other questions? Yes?
Health savings accounts, is there any limit, are there limitations put on what you can spend it on? For example, with health insurance usually doesn't cover like implants or, chiropractor work or that kind of stuff, acupuncture. Is there any limits that are put on the health savings accounts?
That's a great question. Yeah, you could take that.
Yeah, so the question was, are there any limits or, in other words, qualifications as to things you can spend the health savings account dollars on? In order to reap the tax-free benefit of a health savings account, the services that you need to or would be spending, let me backtrack. In order to spend the health savings account dollars on a tax-free basis, it needs to be spent on qualified medical expenses. If it is not considered a qualified medical expense and you wanted to go do your grocery shopping with your HSA dollars, essentially you could, but you'd be penalized as well as taxed for doing that.
How do you determine what a qualified expense is?
Sure. There's a long list that I'd be happy to send to you, yes. So any type of procedures that you'd receive at a hospital or in a doctor's office, prescription drugs, it just falls underneath certain codes. So if you'd like, I could send you a list on what a qualified medical expense is. There's a good amount of them.
Are implants covered under
if it's considered medically necessary, I guess was how I would answer that. I could refer back to the list to double check. That's an interesting one. Yes.
Do you need a referral for Blue Precision HMO?
That's a good question. So the question is, do you need a referral if you're enrolled in the Blue Precision HMO? Yes, that one is going to function like a standard HMO. The only HMO network available that won't is that the Blue Care Direct that I talked about in collaboration with Advocate. That's open access, meaning you can freely go to specialists without a referral within the Advocate healthcare system. Do I have any other questions? And of course, Johnny and I are going to be here for as long as we need to be to answer questions that you guys have. If you want to come up to us individually, feel free. So thank you all for coming. Thank you.